Good afternoon. My name is Robert Carlson, and I'm a medical oncologist and Chief Executive Officer at the National Comprehensive Cancer Network. NCCN is proud to participate in the 90th anniversary of the Maria Skłodowska-Curie National Research Institute of Oncology and celebrate your achievements in advancing high-quality cancer care in Poland and worldwide. I want to first acknowledge your institution's namesake, Maria Skłodowska-Curie, and her significant contributions to the field of cancer treatment, medicine, physics, and chemistry. As a pioneer in the research of radioactivity and radiation, she broke down barriers and revolutionized ideas. She was the first and only woman to be awarded 2 Nobel Prizes, and her legacy continues through the work of the Maria Skłodowska-Curie National Research Institute of Oncology. My remarks today outline the ways that NCCN's mission and global priorities complement the long-standing achievements of MSCI. I will then highlight our ongoing partnerships in Poland and how these partnerships hope to expand our collective impact moving forward. NCCN is a nonprofit alliance of 32 leading cancer centers in the United States. Our mission is to improve and facilitate quality, effective, equitable, and accessible cancer care so all patients can live better lives. Through the expertise of multidisciplinary teams, we develop a number of resources that provide valuable information for multiple stakeholders in the healthcare delivery system. Most notably, we develop the NCCN Clinical Practice Guidelines in Oncology that detail treatment recommendations throughout the continuum of care. These guidelines cover over 97% of cancer cases globally. NCCN guidelines are a recognized standard for clinical practice and have expanded from 8 initial guidelines in 1995 to 83 extensive guidelines today. These guidelines are developed by 62 different guideline panels, most of which have between 31 and 35 experts. Last year, more than 1,700 multidisciplinary experts from NCCN member institutions volunteered more than 40,000 hours to the development of NCCN guidelines. Although we are a US-based organization, NCCN resources are accessed and utilized throughout the world. Of the current 1.5 million registered users of our website, roughly half are located outside the United States. In 2021, there were 13 million downloads of NCCN guidelines, with nearly half of the downloads going outside the United States. NCCN has an active presence in Poland, with more than 6,000 registered users and over 80,000 NCCN guidelines downloaded last year. This graph represents the top 10 NCCN guidelines downloaded in Poland for 2021. Given the global utilization of NCCN guidelines, we are committed to growing a library of resources to ensure that providers and patients have access to the most up-to-date standards in cancer care around the world. To continue to make NCCN guidelines accessible for non-English speaking practitioners, we focus on the importance of translating NCCN content. We have a growing library of over 270 translated NCCN resources with over 53 different languages represented. NCCN also collaborates with in-country and in-region physicians, professional societies, and patient advocacy groups to develop the regional adaptations of the NCCN guidelines. The adaptations account for country-level differences that might include metabolic differences for specific populations, variation in regulatory approvals, and differences in the accessibility of resources. NCCN also develops resource-stratified guidelines and harmonized guidelines that are focused on low and middle-income countries. In 2013, representatives of NCCN and the Polish oncology community met for the first time to begin discussions relating to improving cancer care. Ultimately, a colleague and I traveled to Poland to present during a session of the Polish Oncology Society meeting on the importance of patient advocacy in cancer care. Subsequently, I had the opportunity to travel to Warsaw and speak at the first International Congress of Patient Empowerment in Poland. During that trip, I also met with leaders in the Polish oncology community, including physicians from MSCI, Polish advocacy organizations, Alliance for Innovation, representatives from the Ministry of Health, and with the U.S. Embassy. In 2018, I was pleased to be invited to attend a senior leadership workshop in Warsaw, co-hosted by MSCI and Alliance for Innovation. The workshop focused on improving translational research and strengthening cancer control in Poland. The workshop addressed the importance of NCCN guidelines throughout the continuum of care and explored a collaboration to develop and implement NCCN guidelines adapted for Poland. As a result of these discussions and the commitment of our Polish colleagues, we signed a memorandum of understanding with both MSCI and Alliance for Innovation focused on further advancing evidence-based cancer care in Poland. As part of the initiative, in 2021, Alliance for Innovation, MSCI, and NCCN co-hosted a virtual education workshop focused on NCCN guidelines methodologies, best practices, and impact. Attendees for the workshop included Polish oncology groups and oncologists, Polish Health Technology Assessment Agency representatives, Ministry of Health representatives, and Polish patient advocacy groups. Following the educational workshop, Polish thought leaders in NCCN began adapting the NCCN guidelines for cervical cancer and for central nervous system cancer. We at NCCN want to take a moment to acknowledge the expertise and contributions of these experts as participants in the Polish committees, who contributed their time and substantial expertise to develop the adaptations. The adaptation of these two guidelines provides a foundational framework to develop, implement, and update additional adapted NCCN guidelines for Poland, and will serve as a recommendation report for the Polish Ministry of Health to facilitate National Cancer Plan implementation. The group plans to adapt guidelines for 16 additional areas of cancer in Poland. In 2022, the collaboration will also focus on online engagement and training of patient advocacy groups in Poland to facilitate their active participation in guideline development and policy advocacy. Moving forward, Polish and American leaders are actively identifying areas of mutual interest for new joint research projects. Areas of alignment include melanoma clinical trials, cancer care registries, real-world evidence, and quality care improvement research. The successes of this international project have been defined by strong leadership across all of the participating organizations, and NCCN is excited that this is the beginning of a multi-year collaboration to collectively impact cancer care for patients in Poland. Through our global work, we know that it is easier to predict and fulfill cancer care needs when we work together to standardize care on an international scale while adjusting for regional variations at the local level. We also believe that everyone worldwide should benefit from the rapidly expanding knowledge on how to treat cancer most effectively. This goes both ways. When we work with experts in Poland, we learn valuable lessons for improving cancer care in the United States. It is important that we all continue to engage with the multiple stakeholders in the global healthcare systems to further advance evidence-based care globally and to ensure that providers and patients have access to the most up-to-date standards in cancer care around the world. NCCN is proud to work alongside our colleagues and friends at the Maria Skłodowska-Curie National Research Institute of Oncology and Alliance for Innovation to advance high-quality cancer care in Poland. Thank you.